You have spent your entire life and career listening to women in and outside of the exam room through your writing. In your expert opinion, what are some of the biggest environmental threats that women face today, and how does this affect women of color differently?
You know, I think the biggest environmental threats are really the basic things: clean air, clean water, safe environments, and really access to medical care. And I think that all of those things are disproportionately affect women of color simply because they have less of an ability to control those external factors.
In your book, Grown Women Talk, you are helping to bridge that gap of information and helping to equip women with resources they need to be able to identify risks in their environment, for example. When in your journey did you realize that we had such a desperate need for better care and for better awareness regarding women's health?
You know, I think I've always known this. You know, I grew up in Mobile, Alabama, and I lost my mother due to a preventable disease, incurable disease, had she known what to do about that. So the information gap was always there of not knowing what the signs and symptoms are and not really having access to the correct medical treatment, because we have to deal with the fact not only to just the individual racism that exists within the medical system, but how the entire medicine system, this is sort of how it was created from a basis. That's always been clear to me, that even from when I was a child, that we did not get equitable care.
Yeah. It wasn't something that you read about. It was something that you saw firsthand.
It was something I lived. The physical environment of where we lived. I lived next door to a TB hospital. These are the kinds of things, the exposures. We had toxic air. We had the paper mill, which regularly discharged into the air that we breathed. I knew Black people who lived in the South who lived next to waste dumps. Now, you have to figure what's in your air, what's in your water, if that's the environment that you're in. So we need to address those things.
You've talked a lot about willpower, and that's what's lacking more so than anything, right?
Exactly. It's not like we need another study to find out whether or not living next to a chemical plant is bad for your health. We know that. Yeah. Everyone knows that. That's why they don't put those things next to wealthy communities, because they will not have it. They know what the outcomes are.